Good morning, students. Today's lecture is on an overview of study designs and the cross-sectional study designs in particular. Before going to today's lecture, we will have a quick recap on the previous lecture. It was on steps in medical research, selecting study setting, topic and supervisor, literature set, formulating research question and hypothesis, sampling, choosing appropriate study design, questionnaire development and validation, ethical approval, collection of data, analysis of data, presentation and publication of data. Today we will be focusing on the fifth step, that is choosing appropriate study design. Learning objectives of today's lecture. At the end of this session, the student should be able to identify and enlist various types of epidemiological study designs. Select an appropriate study design to conduct research in an area of interest. Describe the characteristics of cross-sectional study design. The ultimate aim of conducting a medical research is to study if there is an association between exposure variable and outcome variable. Outcome variable is the dependent variable. The exposure variable or risk factor is the independent variable. I will give you some examples. Lung cancer is dependent on smoking. So dependent variable is lung cancer. Smoking is the independent variable. Reduction in heart attacks is related to exercise. So the dependent variable is reduction in heart attacks and independent variable is doing exercise. Type 2 diabetes mellitus is dependent on abdominal obesity, which is independent variable. Epidemiological study designs can be broadly classified into two major classifications: observational study or experimental study. Observational study can be of two types: descriptive study or analytical study. Descriptive study can be case reports, case series analysis, or cross-sectional study. Analytical study can be case control, cohort, or ecological study. Experimental studies can be randomized control trial, non-randomized control trial, quasi-experimental trials, or community intervention trials. The classifications, there are more classifications. Observational and experimental we have seen. Qualitative research and quantitative research. Applied research or fundamental research. Longitudinal research or cross-sectional research. Longitudinal research is otherwise known as follow-up research. The cross-sectional research is otherwise known as prevalence study. Descriptive epidemiological studies describes the disease in terms of time, place and person. When it occurs, where it occurs, who are affected. Descriptive studies help in formulation of hypotheses. Descriptive studies can be of three types: case reports, case series, or cross-sectional studies. Case reports means one single case, detailed description of that case, showing the management, showing the all investigative findings. Case series means a group of cases, describing the group of cases. Cross-sectional studies are prevalence studies. We will see in detail today. Analytical epidemiological studies study the relationship between risk factors and outcome. It tests etiological hypothesis. It is slightly higher than the descriptive studies. Quality of analytical studies are higher. It can test the etiological hypothesis. Descriptive studies are only formulating the etiological hypothesis. Analytical studies can be case control, cohort, or ecological studies. Design of a case control study. There will be two groups. One group are cases and other group controls. In this example, in this diagram, cases are cancer patients and comparison groups are non-patients. And we are inquiring about the history of exposure to a risk factor in the past. So direction of study is backward. We are seeing the patients and non-patients, inquiring about history in the past. Direction of study is backward. So it is known as retrospective study. Cohort studies. Cohort means a group of individuals sharing the same characteristics. Cohort studies can be prospective or retrospective. We will see prospective first. Two groups of individuals are there. Group of interest can be one group is exposed to a risk factor, another group is not exposed to a risk factor. And we have to follow them, both the groups, for a period of time and see how many of the exposed group are developing the disease. How many of the non-exposed group are developing the disease. Direction of study is forward. So it is a prospective cohort study. We are comparing the outcome in both groups over time. The retrospective cohort study is different. We are getting the information of exposed group and non-exposed group from the past record, and we are following them up for a period of time in the past to the present time, and we are checking. For example, I will tell you, if we take a non-smokers group from 2005 and a smokers group from 2005 and following them up for a past 10 years. During the period from 2005 to 2015, how many of them are developing lung cancer? How many of the non-smokers are developing lung cancer? So this direction of study is backward. We are starting from today and checking how many of the smokers developed lung cancer in the past 10 years. How many of the non-smokers developed lung cancer in the past 10 years. Because direction of study is backward, it is known as retrospective cohort study. Ecological study. It's also an interesting type of study. Okay, this unit of observation is a community or population or a country or a state. Okay, we are studying the disease rates and exposure rates in each of the series of population, and their relation is studied. For example, I am taking Selangor and Perak and comparing the relationship between air pollution and lung disease in Selangor and air pollution and lung disease in Perak state, and I am comparing which state is having more risk of developing lung disease due to air pollution. Experimental study or intervention study is another type of study design. It is having more quality of evidence in the hierarchy of research. Study the effect of experiment or intervention to produce an outcome. It confirms etiological hypothesis. I told you, descriptive epidemiological study formulates a hypothesis. Analytical epidemiological study can test the hypothesis, but for confirming etiological hypothesis, we need experimental study or intervention study. Examples are clinical trials, randomized controlled trials, non-randomized trials, otherwise known as quasi-experimental trials, community intervention trials. Experimental research, one group of individuals is exposed to an intervention. They are known as experimental group, and the other group is not exposed to the intervention. They are known as the comparison group or control group. Occurrence of outcome in both groups are compared. Next, higher to randomized control trial in the hierarchy of evidence. Quality of evidence is higher for systematic review. Systematic review is a type of literature review. It collects and critically analyzes multiple research studies or papers in a systematic and scientific way to reach conclusion. Some studies may be telling that this treatment A is beneficial. Some studies may be telling that treatment A is not beneficial. We will collect all the studies and systematically analyze, critically analyze, and come to a conclusion if treatment A is good or not. The result or conclusion of systematic review can be used in clinical and public health policy and practice. Another type of study design is meta-analysis. Meta-analysis is a method used for systematically combining study data from different studies. I told you in systematic review we are critically analyzing the study finding from multiple research in a systematic way. When we collect data from multiple studies and analyze it and come to a statistical conclusion from several selected studies to develop a single conclusion that has greater statistical power. Okay, when we apply statistical analysis in a systematic review, it will become meta-analysis. Another classification is applied research and fundamental research. Applied research is otherwise known as action research. It is carried out to find out solution to a real life problem requiring an action or policy design. Students can identify a problem which is faced by the patient or community and find out a solution to reduce that problem or solve that problem. Then it becomes applied research or action research. Many of the public health research are action research. Fundamental research or laboratory research. It is otherwise known as basic or pure research. It is undertaken for the sake of knowledge. Okay, out of intellectual curiosity. And it is not necessarily problem oriented. Fundamental research is also very important in medicine because of scientific curiosity of the researcher. Many new findings we make. Quantitative research and qualitative research. Quantitative research means is employed for measuring the quantity or amount of a particular phenomenon by number, proportion, rates or ratios by the use of statistical analysis. Qualitative research is the qualitative type of analysis which aim at finding out quality of a particular phenomenon, perceptions of participants or opinions of participants by using observation, interviews, group discussions. Longitudinal research is another type of research. Data collected more than one time. These are otherwise known as follow-up studies. It is like a videograph. We are seeing the patient again and again at multiple intervals. Examples are prospective cohort studies or some descriptive studies in which data regarding risk factors and outcome are collected at multiple times, more than once. Now we will go to cross-sectional study. Cross-sectional study is a type of observational and a descriptive study. It is otherwise known as prevalence study. Data collected from a cross-section of the population or a sample of the population which is representative of the total population. Patients who form the part of a group are studied. Female patients with diabetes, Chinese patients with diabetes. We can study a group of the population. Frequency of complications and risk factors can be studied. How many of the patients have diabetic retinopathy? How many of the patients are not compliant to anti-diabetic treatment? We can study the prevalence, total number of patients with diabetic retinopathy, total number of diabetic patients who are not compliant to treatment. Patients are not followed up in time. Data regarding risk factor and outcome are collected at one time. Can you see the photograph of a camera? Cross-sectional study is like a snapshot in time. Okay. Main outcome of the cross-sectional study is prevalence. Example, 20% of diabetic patients attending the clinic suffer from diabetic retinopathy and 30% of diabetic patients are not compliant to treatment. One advantage of cross-sectional study is we can study more than one group. Chinese, 10% of Chinese, 13% of Malay and 18% of Indian diabetic patients were suffering from some form of retinopathy. Can be used to study if there is an association between risk factor and outcome but cannot confirm causal relationship. Okay, can be used to formulate the hypothesis. We cannot test the hypothesis or we cannot confirm the hypothesis. In cross-sectional study, we cannot say how much higher risk of developing diabetic retinopathy is present among those who are non-compliant to diabetic treatment. For that, we need analytical studies such as cohort study or follow-up study is needed. Cross-sectional study, we can say if there is an association between risk factor and outcome. We cannot say how much higher risk it is. We cannot say the incidence of risk factor. We can say the prevalence of risk factor or prevalence of outcome. This is a quality of research evidence. There is a pyramid showing the quality of research evidence. You can see fundamental research or test tube research will be having the lowermost quality, followed by animal research, then ideas, editorials and opinions of researchers come next. Then comes case report of single case series of a group of case. Then come analytical studies like case control, then cohort study, then randomized control trials, the double-blind studies. That means randomized control trials in which patients don't know in which group they belong. Experimental group or control group, they don't know. Doctors who are treating them don't know in which group the patient belongs. Highest in the quality of evidence is systematic review and meta-analysis. Okay, now the quiz. Description of disease in terms of Time, place and risk factors. Time, place, person and risk factors can be the descriptive study. Determine prevalence and characteristics of disease. Cross-sectional study. Describe natural history of disease and incidence. Cohort study or longitudinal study. Determine cause and effect. Cohort or case control study. Compare different interventions. Randomized clinical trial or community intervention trials. Review of several studies. Systematic reviews or meta-analysis. Thank you very much for your listening and